This morning, a deaf toddler hearing for the first time. With advances in gene therapy, it's a new reality. 3-year-old Opal Sandy was born deaf. Her big sister had paved the way. Nora, now 6, was also born deaf.
Both girls had no hearing whatsoever, so we're talking like big massive drums and cymbals being banged behind their heads. There was never a response, even at the very highest levels that they can test.
Come on.
Both girls' deafness was caused by a faulty OTOF gene, an inherited condition linked to profound hearing loss.
It's a big surprise to us. We later found out that both me and Joe are carriers for a genetic condition which we have no idea about. I think it's pretty rare in the fact that one of us is a carrier, let alone both of us.
Big sister Nora had cochlear implants put in early on. Her doctors alerting the Sandys to a new gene therapy trial for the OTOF gene, not far from their home in the UK. Opal was the perfect candidate. In September 2023, Opal, just 11 months old, was the youngest in the world to have a gene therapy injection into her right ear. Doctors also supplying a cochlear implant into her left.
The gene therapy infusion was actually a 15-minute process. So sort of a life-changing event for us. It was a very quick procedure.
And 3 weeks after surgery, there was a surprise. Opal's cochlear implant was off, her mom Jo clapping behind her.
It was mind-blowing. I mean, even at that stage, we were really pleased because a child being able to hear really loud noises is obviously really fundamental from a safety perspective as a parent.
6 months later, she was picking up softer sounds and speech. And today, at 3 years old, she can hear normally, even without her implant in.
Opal, whose birthday is it today?
Mine.
And how old are you?
It's just amazing. This week, Regeneron revealed that 11 of 12 patients in this trial, including Opal, experienced, quote, clinically meaningful improvements in hearing within weeks. And the FDA also just announced that this same gene therapy has been selected as part of a brand new voucher program aimed at getting faster approval for medicines like this to help patients nationwide. Just great stuff.
It really is remarkable.
Yeah.
Really incredible. ABC News Chief Medical Correspondent Dr. Tara Narula is joining us now. Of course, we'll sit next to you, who's going to give us more insight into gene therapy. And Dr. Narula, we see this now. This was used to restore hearing. What other things are being investigated with this type of therapy?
Michael, gene therapy is advancing so quickly, and we're seeing it for inherited disorders, acquired conditions like infections or cancers, and hopefully to treat some of the over 7,000 rare disorders or diseases that exist. There are different types of gene treatments. There's gene therapy, where you essentially add a gene editing, where you alter a gene that exists, or even gene silencing, where you turn off a gene. And as of now, the FDA has approved over 30 different types of cell and gene therapies for conditions like sickle cell disease, hemophilia, thalassemia, certain cancers, leukemias, and lymphomas, also some spinal muscular atrophy or muscular dystrophy, and even a congenital retinal disorder that causes blindness. And they are investigating it for even more conditions, things like HIV, Alzheimer's disease, certain cardiac conditions, cystic fibrosis, and immune deficiency disorders. So we are just seeing this wide advancing field. We are hoping that with AI, we will also see improvements in terms of precision and efficiency of these. Researchers are looking into improving safety and how we deliver it, but cost is still an issue, and certainly getting companies to invest in this from a research standpoint.
Yeah, I'm pretty sure it's pretty cost prohibitive for so many people and so many businesses. But when a gene therapy is like that, when do you think that they'll become standard treatment? And if there's someone out there, how can our viewers learn more about these trials?
Yeah, absolutely. I think we are definitely going to see this in the future. And really the idea is to catch these diseases before they ever develop, right? So you're not just treating the symptoms of the disease, you're just preventing something from happening. In terms of wanting to get involved, patients can, or people can go onto websites like clinicaltrials.gov or researchmatch.org. You can see if the trial's enrolling, what are the eligibility requirements, where are they happening. Usually will be at these advanced academic medical centers, but certainly important to get involved if you are concerned or think you may have a family member with a condition like this.
All right, Doc, thank you for your insight. And Will, thank you. Really incredible. You're just getting started. This is just the beginning. Will's going to have more breakthroughs coming up, exoskeletons that are helping people walk, prosthetic to help people feel touch. That's all in the coming weeks.